Good afternoon. Welcome everyone to the Northern Colorado Health Sector Partnerships Virtual Healthcare Chat. Today we are going to be talking about three very important occupations in healthcare. These are great entry-level positions, and we are also going to learn about some funding that exists in our workforce region to help support these three occupations. So before we jump into meeting our panelists, I do want to just go through some logistical things. So the audience members, it would be great if you guys can stay muted. That way we don't get any weird echo sounds. We love to see faces. So if you feel comfortable and you want to turn on your camera, we would love to see your face to know who you are and feel like we're interacting. And you're welcome to use the chat for questions. We will have someone keeping an eye on that. And we also encourage people to come off mute and put their camera on and ask questions if they have their own questions. And so this is informal. We want you to be part of the conversation. If we're talking about something and you have a question, we want to get that question answered. So please feel comfortable asking. There is a raise hand feature that you can use to get our attention. And then also, we are going to, for the sake of time, try to get as much information as we can. But I do want to, I introduce what we're focusing on today. The Northern Colorado Health Sector Partnership, for those of you who are not aware, they bring together key stakeholders to promote and improve health within our communities. So they bring together industry, and they use industry at the forefront to collaborate with education, workforce development, economic development, and other community partners to seize opportunities to respond to the changing healthcare environment, to solve collective problems, and of course to celebrate successes that we have in our region. So this is sponsored and supported by this Health Sector Partnership, and if you're interested, please put in the chat if you are, and we can share out the website for the Northern Colorado Health Sector Partnership. So I am Sandra Jackham, and I am an advocate and collaborator with the Sector Partnership, and I am going to be your facilitator today. And with that, I am going to have our panelists introduce themselves. We'd love to know, what's your name, where do you work, and what is your role or occupation within your organization? And I'm going to call people out, so we'll start with John.
Hey guys, my name is John. I work as a CNA at Center Avenue Health and Rehab, and I'm also a medical equipment technician for Columbine Medical Equipment here, and I've been doing medical equipment for about 3 years, and I've been doing CNA for about a year. I completed the CNA program through scholarship here at Columbine, and I've been working as a CNA ever since, and I'm currently in nursing school to be an LPN.
Thank you, John. Erica.
Yeah, my name is Erica Austin. I am a medical assistant with Dr. McLaughlin at Associates in Family Medicine. I started here originally in 2014. Ended up going to a couple other offices to get some experience, some other specialties. Came back here about a year and a half ago, and I'm pretty much just stationed over here with Dr. McLaughlin now.
Thank you. Kaden, welcome, and please introduce yourself, where you work, and what your role is.
Hey. My name's Kaden. I'm a current EMT for the radiology department at Medical Center of the Rockies. I've been in this role for about a year now, a little over a year. I've been at the hospital for a year and a half. Yeah, just enjoying it. Working mainly in the CAT scan department. So, yeah.
So Kaden, can you share with everyone a little bit about what a typical day looks like for you? Because you're not, traditionally people think of EMT as the ambulance folks, right? So share with us a
Right.
little bit about how your role looks different at UC Health.
Right. So my typical role is starting the IVs for all outpatient CT or all outpatient CT patients that are receiving IV contrast, as well as helping out with MRI patients that receive their contrast. And yeah, main role is just starting IVs. Not the traditional ER tech or ambulance EMT. So yeah.
Thank you. And Erica, can you tell us what a typical day looks like for you?
Yeah, so we start at about 7:15. We see our first patient at 7:30. And then we see them all day until about 5 o'clock. We see probably 18 patients a day. A mix of everything. Well child visits, COVID testing, just sprains, injuries, procedures. We do all kinds of things. I've had 2 IVs that I've had to do this week on some of our OB patients because we do see obstetrics and gynecology as well because the provider I work for delivers babies. So I do lots of IVs on our moms to be. We have procedures every day. We do lots of IUD removals and inserts, circumcisions because she has lots of babies being born. I feel like we're pretty well diverse throughout the entire day. It's never the same. It's always kind of crazy. Someone came in today with upper respiratory stuff and ended up being depression because her sister passed. So it's always kind of a mystery what really is going on until you see them.
Great, thank you.
Mm-hmm.
And John, can you share what a typical day looks like for a CNA?
Typical day that I'm not at nursing school and working as a CNA, I get there about 6 a.m. and we give report to each other, taking over for the overnight CNAs. Depending on if I'm in the long-term care section or the acute rehab section, it kind of changes how the day goes. With the acute care, we'll just get specific report on different tendencies and behaviors of people, and we'll get them up accordingly and get them, going with their daily activities, And then upstairs, it's pretty much the same thing with the long-term care people. We just get them up, get them going, take a lot of vital signs, ambulate them to the toilet, do a lot of cleaning. So it's a dirty job, but someone's got to do it, and I'm happy to do it.
So thank you for that. And can you talk a little bit, John, about the training program that you completed and how you felt like it prepared you for the position? And then any certifications that you may have? How long did the training take? Those types of things.
Yeah, the training program, I did that a year ago last fall, and it was Monday nights and Wednesday nights, like 6 to 10. We did the training, and we basically focused it around taking the CNA state test for getting the CNA license, and it prepared us for general safety issues that could arise with moving people, changing people. That sort of thing is very heavily focused on keeping people safe, and that gave me the skills to just be safe almost unconsciously when I'm working as a CNA.
So was the training a lot of classroom-based learning? Did you have like clinical components to it?
We had, for about the first half of class, it was kind of going through a textbook, just kind of going through point by point issues that arise. And then the other half of the class, we went into the lab, which is essentially just like a person's bedroom. And we would go through all kinds of things with moving people in beds, doing peri-care on people, on mannequins, that sort of thing. We were kind of limited as far as clinicals go because it was during a bad time of COVID, so we did sort of like a mock clinical, which was kind of unfortunate. I really wanted to get in there before I started working, but even with not being able to do that, I was still pretty much prepared to at least be competent safety-wise with helping out in the CNA role.
Great. And did you have a quick transition when you completed that state certification into the actual CNA role?
Yeah, I think it was maybe like 2 or 3 weeks, and then I started working. It took me maybe a month or two to get the final CNA license, because you could operate it as a CNA, I think for like 6 months or something like that, before getting your physical skill evaluation done. So yeah, I went basically right after I finished, I went and worked as a CNA.
And how many weeks total was that training program?
I want to say it was like maybe 8 weeks, something like that. I don't know for sure. It seemed like maybe 2 months, so not entirely sure, but probably like 8 weeks, ballpark.
Perfect. Thank you. Erica, can you talk a little bit about the training program that you went through and how it prepared you for the position, any certifications or degrees that you hold, and then how long the training took to complete?
Yeah, so I went through College America in 2009 for my MA. It took 2 years to get. I went Monday through Thursday, 4 hours a night after work. And so I did that for about 2 years. And then I did we had to do an externship. I can't remember how many hours we had to complete, but it took me about 2 months to complete my externship. And I actually did that here at Associates in Family Medicine. I reached out to them and did that here. And then got hired on right after my externship. I just applied here and they hired me on right out of school. And so that was fantastic. And then I just stay up on my CMEs every year. Some people kind of let that lapse, but I'm kind of obsessed with it. And so I don't want that to lapse, but every year I stay up on my CEs and submit them and keep my certificate active. I just got since I started working with an OB provider, I just got my IV certification about a year ago. Because as an MA, you don't graduate with that. And so I had to go back for that. And that took about 3 days down in Colorado Springs. And the only place I could find that does that for a medical assistant was, I went through Saving American Hearts down in Colorado Springs for 3 days to get that certificate. It was like $300. Then I make sure to stay up on my CPR, my first aid, my bloodborne pathogens. It's all about the certs. And so I try to stay really up to date on those. Thought about going back to nursing school, but I just don't know if I really want to do that. So I'm pretty happy with just being the medical assistant that I am, but I'm really happy with my role. So it took about 2 years, and then I stay up on it every year. It takes me probably about 4 hours to keep up on that recertification a year.
Great. And can you talk a little bit about why some MAs don't continue that certification every year or recertification every year?
So a lot of times, so medical assistants, they don't work under their own like license number. You work under your provider that you work for. So since they're technically liable for you, if there's any mistakes made, it falls under them, that provider. And so a lot of people just kind of like, well, I'm working under their insurance and that's fine. And I've been doing this for so many years, I don't need to stay up on it. And a lot of places don't require it. But I have been places that do require it. And I just don't ever want to be in that position. I want to be able to apply everywhere because all of my degrees and certificates are active versus not being able to apply at a certain place because I let it lapse. So yeah, some people just don't think it's important because you work under your provider's insurance, but I just want to make sure I have options.
Great. Thank you for that information.
Yeah.
And Kaden, can you share a little bit about the training program that you went through, any certs or degrees that you hold, and the length of time it took you?
Yes, I can. So I became an EMT the summer of 2019. So been an EMT for a couple of years. That schooling was 3 months, 3.5 months to 4 months, Monday through Thursday, where we did clinicals and practicals all throughout those 4 months. In the end, I had to take the National Registry EMT test. Once I completed that, I registered as a Colorado EMT. And then from there, I went to IV school, which was just a week, where we finished with having to complete 10 successful IVs on inpatients in a hospital. And then from there, got a job as a patient transporter here at the hospital, and then found this job that I'm in right now. So it's took me about 6 months altogether, between taking tests and the waiting periods and classes and all that. So it wasn't too long, but got a lot done in those 6 months.
Right. And the position that you applied for at MCR, was it labeled as an EMT, or is there another job title that you just knew you had the skill set for?
It was labeled as an EMT, EMT slash tech aide. So another role of mine is helping CAT scan, helping all the techs in that department, making sure everything's running smoothly with them because they get pretty busy at sometimes. But the original job was labeled as EMT, so it definitely caught my eye why I took it.
And another follow-up question to that is, when you were going through your training, were you aware that these types of positions existed within the acute care setting?
No, I was actually not aware of this position at all. It's a fairly new position in our hospital. And since working here, they have opened up, or in the process of opening up this position at PVH as well. And I believe maybe one or two other hospitals. So it's pretty new. From what I heard, most hospitals, they have nurses that do what I do, prep the patients for CAT scans, as well as the techs. They do that. So it's really new. Nothing I heard of before becoming an EMT.
Yeah, totally. Thank you for that. And I'm curious, Kaden, looking now that you're in kind of that hospital system, and you already sort of had some transgression from patient transporter into this, do you see other growth opportunities that exist for you along this career path that you're on?
Definitely. I believe it's only the beginning. I've definitely considered moving over to the ER, since we work closely with them, as well as possibly working on the ambulance. So it's all interconnected with one another. So there's definitely room for growth, as all fields in the healthcare system. So yeah.
And then you talked about the cross training that you got to have doing CT scans. Are there other opportunities for you to cross train to other departments to kind of add to your abilities, within the scope of work that you do?
Definitely. Right now, I help out with MRI a little bit, prepping patients for them. Our radiology nurses here, I help out with them when they need it, taking vitals and starting IVs and helping them with the roles of ER tech would have, turning rooms and discharging patients and all that. So there's definitely other places to go, and that I do possibly see myself fulfilling in the near future within the department.
Great, thank you. And Erica, can you talk a little bit about any kind of growth opportunities that exist for you? I know you talked about doing the IV and having access to that, but do you see other opportunities and ways that you can cross-train?
Yeah, I know like there's always opportunities to grow, especially like there's always way to further your education. But as far as like staying in the same role you're in, like I could, right now they're looking for like a clinical manager for one of our offices. And like, I mean, you know, they just really want you to have experience for about a year. I'd be qualified to apply for that. I'm really happy with where I'm at. I love being hands-on with patients. I'm not one that wants to like sit back and like be like a manager, or anything like that. But as far as my scope of practice, the IV certification was the big one that I really wanted because that was holding me back with lots of different things that I needed to do for my provider in particular. The only thing I'm not allowed to do with that is administer medications. With IVs, I can hook them up to fluids, but I can't push meds because it goes through, since it's filtered through the heart, it has to be a nurse that pushes meds. But I mean, I feel like as far as like the certifications and all those, I stay up on pretty much most of them that I can. But I'm pretty happy right now. There's no other ones that I'm really looking for, and as far as for what I'm looking for, but there's definitely plenty of manager positions available like now.
And I'm wondering, because I know you talked like you're working with a certain provider that kind of has some sort like, family practice kind of stuff, but also, working with mothers.
Yeah.
Within associates in family medicine, is there any other scope of work that an MA could do that's a little bit different than what you do?
Oh yeah, absolutely. We have some medical assistants who are just like team, and they come in and just help out at other offices. And while we're working with our regular providers, our regular patients, if we have a walk-in that thinks we're one of the urgent cares, and because we have some urgent cares, but this office in particular isn't an urgent care. But sometimes they get confused, and we'll come in here and we'll still treat them. We'll have our other MAs here that will triage them, get their full sets of vitals, go find like the late doc or on-call doctor and go talk to them to kind of get their input, whether they need to be seen right away or if it's okay to let them go schedule a visit. We have some of our MAs that work just in nursing homes with our providers over there. And so they're just strictly in nursing homes and assisted living facilities. We have some MAs that are just like scribes, even just scribing for their doctor. There's some medical assistants that are just working up at the front desk so they could get their feet a little bit warmer with hands-on stuff, because some people did do clinicals. The clinicals were hard because it was during COVID, and so a lot of people didn't get hands-on. A lot of it was virtual, and so we even have some that are up at the front desk like scheduling and just kind of doing baby steps. But they are pretty much in every role at AFM, anywhere from front desk to nursing staff. They can kind of fall anywhere in between there.
Great, good information, thank you.
Mm-hmm.
And John, you gave us a little bit of a pathway step that you've already taken. Can you talk a little bit more about other opportunities that exist for you to grow?
Sure. Biggest one is the availability of a scholarship through Columbine to pursue like a LPN education. So I applied for that and got the scholarship. So I do CNA work on the weekends, and then during the week I go to Front Range Community College, and we're training to be LPNs, and it's very rigorous, and I don't get much sleep. But that's okay. It's only a year-long process. So we have about 3 or 4 more weeks until our Christmas break. I'm looking forward to that. But I am enjoying the experience of learning how to do it all, and it's a very rewarding experience. And I look forward to being a CNA on the weekends as sort of a break, so I can just sort of like hang out with my elderly friends and take care of them. So it's working out pretty good. Yep.
So can you talk a little bit about the kind of availability that Columbine offers? Because you're working and you're going to school, and you did that through your CNA, it sounds like, and you're doing it through your LPN. So what kind of flexibility do they offer to allow you the time for that?
Well, it's just like, I think, well, I've been just doing about just one 12-hour shift per week. And then I work in a different capacity as a medical equipment technician on Sundays, and the hours kind of vary. It's kind of just like being on call. But they definitely work around like my schedule so that I can actually be in class and be learning. So that process has been totally fine. The balancing act of doing both. So it's good. And they pay for books and school and all that. So making it work. Yep.
Great, thank you for that. And I'm going to switch gears a little bit. And I want to introduce a couple of folks we have from Larimer and Weld County, who are going to talk a little bit about some funding opportunities that are available in each county. So Tracy Brookover, can you introduce yourself, who you're with, and then talk with us a little bit about the RUN program?
Sure. So as Sandra said, my name is Tracy Brookover. I'm the Adult Employment and Training Supervisor for Employment Services of Weld County. And recently we have a wonderful new funding stream that we are calling RUN, which is an easy way of saying reskilling, upskilling, and new skilling. So this funding stream is very wonderful for anybody who has been affected by COVID. And haven't we all in one way or another? So really what is great about this funding stream is that we can pay for these kind of trainings that we've been discussing today, the CNA, medical assisting, and EMT, as long as it's as long as it is within that 12-month period. But really, when I say that somebody has been affected by COVID, it's there's a pretty vast list that I can talk to you guys about. You know, if you lost your job to the pandemic, if you lost hours at work due to COVID-19, if you had or awaited results for COVID-19, which caused quarantine and you missed hours from work, a member of your household lost their job due to COVID, a member of your household had their hours cut, or they lost work hours due to the pandemic, if you had any other economic impacts, or if your household income decreased as a result of COVID. So there's many different reasons that we can all be affected, and that really ultimately those are the eligibility requirements to utilize this RUN funding to pay for these types of trainings. So it's a huge benefit to our community. And really within Weld County, we're seeing that this can be substantial, especially for folks in the employer side and also in the job seeker side. You know, employers are really needing to get people into the medical field and get them skilled and make sure that they're filling those positions that are not being filled currently. And also job seekers who may not have been able to pay for a training that they've been interested in doing previously. Maybe they don't qualify for financial aid, whatever the situation is, that's where we can kind of jump in and assist with paying for that tuition. So that's really Run in a nutshell. So
Thank
Yeah.
you, Tracy. And we also have a representative from Larimer County. Marcy, would you like to introduce yourself and talk a little bit about, Tracy kind of gave us some really great information about Run. If there's anything different about the program in Larimer County, and then of course, and I'll bounce back to you, Tracy, but how somebody could apply if they're interested.
Great. Okay, my name is Marcy Kastner, and like Tracy, I support the team that has access to these training dollars, and we call it Run here as well. Sometimes right now in the local news, you might see an ad for Ready to Rise. That is the same money. It comes from a House bill. So that's the same money. We all call it Run because of the, as Tracy mentioned, the reskilling, upskilling, and new skilling. So it's the same thing here. We do, I'm not sure what Tracy's limit is, but we can go up to $6,000 for a scholarship. It does have to stay within that 12 months. And really what we're looking for is an industry recognized credential that results in the ability to get into an in-demand career. The other thing, and again, Tracy would have to speak to this, but the other thing we look for eligibility, besides the fact that you're COVID impacted, the family has some kind of financial hardship because of COVID, we also wonder and look for people who may have had trouble with their educational pursuits. It got stopped, it got delayed because of COVID, because we certainly have had that as well. So we're looking for that piece. And so those are the aspects that we kind of look for. We're looking for, of course, Larimer County residency. And if we get someone from Weld, since we share so many folks, then we would refer them over to Weld County, and they do the same for us. So, because every one of these workforce regions has this money.
That's great. And so tell us, how can somebody get more information or apply if they're interested in Larimer County?
So I'll put it in the website, but for Larimer County, what we created, because we do have other funding streams besides just Run. There's a whole nother team that supports different funding streams. And so what we've done is we've created kind of a universal application. And so it's maybe a little bit longer than maybe a traditional intake, but what it does is it helps us determine which funding stream might be available to you. So we've got one universal form. I will put that in the chat, and then anyone who's interested, you go in, you fill it out, and then we start looking at ways that we can make you eligible.
Thank you. And Tracy, if someone with Weld County is interested, where would they go, or how would they apply?
Yeah, so you can actually go to our website. It's WeldGov. I just put it in the chat for everybody, but we also have our website. It's a inquiry form. Basically, you just fill it out. It's, 6 questions. Who are you? Do you have a Connecting Colorado, which is our database that we utilize for job seekers? And what's your age, and determining whether you're going to hang out with our youth team or with our adult team. And we send that off, and you get contacted within 24 hours of submitting that inquiry. So it's a pretty quick turnaround that we have right now if you're interested in getting more information.
Thank you very much. So the intention around talking about these very critical healthcare occupations and bringing on our county representatives is that this will allow the community an opportunity to hear about career pathways that are great entry level into the health sector, and then also providing some resources that are out there in the community to help fund these specific trainings. I heard both Marcy and Tracy talk about it needs to be less than 12 months. And John and Erica and Kaden all shared information that more or less that training is less than 12 months. I know Erica talked about 2 years, but we do know that we have MA programs now in the community that are 12 months or less. And so that is medical assisting is absolutely an occupation that would fit that criteria. But I want to kind of pause really quick and see if anybody out in the audience has any immediate questions before I tag on a couple extra that I have for our occupational panelists. I don't feel awkward with a pause.
Right.
All right. So what I want to hear from our three panelists, our three occupations, is what do you like best about your job? And I'm going to start with John.
Okay. Easily the thing that I like most about my job is connecting with the people the most. I really do feel like these people are like my friends and I'm taking care of. So just sort of being there for them in like a really vulnerable and emotional time in their lives and finding out ways that I can be like a better person or a better professional in helping them go along the process of, you know, getting old and things falling apart. So I really like just being that support for them when they may not have it.
Thank you, John. Erica, best part of your job.
I love the patients. We have a lot of kiddos, and we're always coloring on the table paper. I mean, I have like these bells that I'll wear, fun games we play, but you know, it's really fun to see the kids come in kind of nervous because they're worried about shots and stuff. And then they come in and they see you and they're like, oh yeah, like, you know, they remember you and they kind of perk up a little bit and they're not so scared anymore. Or like our new moms who come in just have so many questions and so worried about like their babies. Just when you sit down and you talk with them and then they're leaving, like you could just see the relief on all of their faces. That they just feel so much better that they have the answers. So I really do love seeing that gratification of them getting the answers that they needed. And then it's just so different every day. Every day is different. And so we come across so many different situations. So I love my people that I see, and I love the diversity that we do.
Great. Love that. Thank you. And Kaden, how about you? Best part of your job?
I really enjoy what the other guys saying as well. Patient care for sure. You know, a lot of the patients that come in to get CAT scans, you know, most of them are ER patients. All the outpatients, a lot of them are cancer patients that are coming in to get checkups. So being able to talk to them and understand what they're going through kind of puts a new perspective on your own life, for sure. Yeah, and just being able to be with patients and talk to them and comfort them in some ways and help them along this new journey that they might be going through. A lot of these patients come in and they're diagnosed with cancers or some type of disease, and being able to start that journey, send them on the right path, making sure that they have the best possible care is what I enjoy the most about the job.
And to the contrast, Kaden, what is challenging about your work?
The most challenging thing is definitely patients that come in and aren't doing well. Patients that are in the most pain that they've probably been in a while. You know, we see a lot of ER patients. A lot of those patients come in and they're hurting a lot. So it's really difficult to see somebody in pain, to see somebody fighting back tears when they should be out doing what that they love to do, but unfortunately they're here in the hospital trying to figure out what's going on. So that's definitely really challenging to see in the job and to be a part of.
Great.
Yeah.
Thank you. And Erica, what do you think is challenging about being an MA?
Hands down, documentation. The documentation, just yesterday with one of the IVs we had, the patient came in, first attempt, she was really dehydrated, wasn't a good stick, got her on the second time. It was just a lot going on in the room when it could have just been taken care of, and she, in the room, it was all fine and everything went well. I mean, I probably didn't get done documenting in the chart for like 3 hours after she left yesterday. You have to put everything, like they requested a blanket, they were rolled over to their left side and needed to use the bathroom. And so it's really hard to provide the patient care and to remember to back up from your computer and help them. And so then that way you kind of come back and just write things down. And so it's really hard or challenging, I guess, trying to figure out, patient needs a glass of water and then you're like getting them their glass of water, so it's all in real time. But you just make it work.
I had never thought about that.
Yep.
That's a great thing to mention for somebody interested in that career.
Yes.
And John, what about you? What do you find most challenging in the CNA role?
A lot of challenges I face are similar to what Caden and Erica experienced. Obviously, seeing people decline is emotional at times and gets to be kind of taxing. And also the documenting, I totally understand. Like, you just want to actually do the real work of helping people, and you gotta like sit at the computer and document a lot of stuff. Charting takes longer than I feel it should, but that's a reality. I'd say the biggest challenge though for me is staffing, because a lot of times we are short-staffed. It's very frequent that we don't have enough people to adequately take care of folks as well as we could be doing. So being short-staffed is something that I don't look forward to. But when we do have everything up and running, it's a well-oiled machine. But sometimes it's hard with being short-staffed.
Thank you for that. And then real quickly, and then we'll kind of round things out. I'd love to hear, and this is going to be a pop question for our panelists. I'd love to hear one piece of advice that you would have for someone who's looking to enter into your specific field of work. And I'm going to kind of let you guys think for a minute, and one of you just jump in and tell me what your thoughts are.
I already know, because I have said for the longest time that when I was in school for my MA, I had no idea how much I would be at my desk with the computer versus in the room with a patient. You are not with patients all day like you think you would be. Like, you think you're in the room with a patient and you're hands-on, and you're helping and you're assisting and you're doing these things, when realistically, 70 to 80% of your day, you are at your desk documenting, triaging, giving immunizations, documenting it. Did they tolerate it well? Did they bleed? Do they need a Band-Aid? And so it would be to not expect that you're going to be with patients 100% of your day. You are going to be at your desk with a computer about 80% of your day.
Great, good advice. Thank you.
Mm-hmm.
I would say to someone that's a new like CNA or maybe a new nurse. I'm not a nurse yet, but I do know that if you treat it from a professional standpoint and not get too emotional, and try not to get too emotionally involved in the work that you're doing, you kind of have a better time of handling the stress. So I like to think of it as like, like a plumber knows all these skills for like fixing a sink. So I know all these skills for like taking care of people, and I'm just going to focus on those skills and be as good as I can at the skills, and try to divide my emotional life from the job as much as I can. Otherwise, stress levels really go through the roof quite a bit. So just trying to find a balance.
Thank you for that. Caden?
Yeah, I'd definitely say get ready to use your hands a lot. Be a lot of hands-on, as well as getting really personal with your patients. Being with them and talking with them, and kind of what John was saying, being able to separate the emotions of the job from your own personal life. Try to leave everything at the door before you leave work. Otherwise, you'll go home in a not the best mindset.
Mhm.
Yeah, lots of hands-on, lots of being really close with patients, and yeah.
Great. Well, thank you very much. I'm going to go ahead and I'm going to be talking for a few minutes. So if anybody has questions, you're welcome to throw them in the chat. But I do want to thank the panelists for coming. I'd love to thank Tracy and Marcy from Weld and Larimer for coming to talk about the funding opportunity that exists in our region. And there is a brief survey that was dropped in the chat. We do love to get feedback. The Northern Colorado Health Sector Partnership is entirely volunteer run, and we want to bring information out to the community about this great industry. And so when we host these events, we want your feedback on it. So please feel free to give some honest feedback in that survey. We do have this recorded, and that recording will get posted to the Northern Colorado Health Sector's website, to their YouTube channel, to their social media channels. So, seek that out if you want to share this recording with any job seekers or students or other folks in your lives that you're interested in, or if you want to revisit because you can't remember information. But thank you all for attending today, and feel free to reach out to the Health Sector Partnership if you have any questions. Thank you all.
Thank
Thank you.
you.
Thanks.